Welcome to Next Anatomy. Today's session we will be learning about all the cut sections, spinal cord, the brainstem, the medulla oblongata pons, and the midbrain. As we already studied in the past videos about the external features of the midbrain, pons, medulla, and the spinal cord. In this session, we will cover away the internal features. At the spinal cord section, we were able to identify the anterior median fissure. This is a posterior median sulcus, central canal, an anterior gray, lateral posterior gray columns, with the gray matter with the nuclei, and the white matter constitutes the tracts, that is anterior white, lateral white, and the posterior white columns. In this cross section on the right half, we could talk about the ascending tracts, and the left half we could able to look on the motor tracts, that is the descending tracts. Especially in the anterior white column, you could able to identify anterior spinothalamic and the lateral side lateral spinothalamic. So this should be a first word to be remembered: anterior and lateral spinothalamic tract. And the second thing is, remember anterior and posterior spinocerebellar tract. And the third thing, in the posterior white column, try to remember the posterior white column, that is fasciculus gracilis, tract of Gall, and fasciculus cuneatus, that is the tract of Buddha, corticospinal tract, and the little portion of anterior corticospinal tract. So now this will be crossed pyramidal tract fibers, so then this will be uncrossed descending on the same side, and this will cross over. That you will study in the next cut section level at the lower part of the medulla as pyramidal decussation. And we have mainly we could able to identify tectospinal tract, vestibulospinal, and the olivospinal tracts. Out of the transverse section of the spinal cord on a gross, I can remember lateral spinothalamic, anterior and posterior spinocerebellar, posterior column, fasciculus gracilis and cuneatus, and have an eye on posterior gray horn. Later what happens, we will try to discuss in the next cut section. And especially for the motor part, we do need the lateral corticospinal tract. Here we ascend into the higher up cut section, into the medulla oblongata. I'm trying to explain you cut section at the lower part of the medulla oblongata. So we could able to name them as at the level of pyramidal decussation. So now as same we had is an anterior, lateral, and posterior gray horns. So now they will be detached nor swollen. Here the posterior horn will be swollen and detached and forms an extension. I could able to call them as a spinal nucleus and spinal tract of trigeminal. This is the first difference you're supposed to remember. And you could able to identify the disruption of the gray matters into the nucleus gracilis and nucleus cuneatus extending into the white column as fasciculus gracilis and cuneatus. And then from the midbrain, pons, and medulla oblongata, wherever you study, the part of the gray matter gets detached and forms an aggregation of nuclei called as reticular formation. You will come across in all the cut sections. Followed by, as mentioned, we had this portion, that is the lateral spinothalamic, which, as I mentioned, anterior and posterior spinocerebellar tracts. You're supposed to remember is the same cut section comparing from spinal cord to lower medulla. Also, while descending tract, I have mentioned you an important one. I'm going to call them as lateral corticospinal tract, which descends down, and as mentioned, once we go back to the previous slide at this level, lateral corticospinal tract, which are crossed fibers. Try to check it over here. The fibers are crossing towards to the counter opposite side. So the level of crossing takes place at the lower part of the medulla oblongata. So we do name them as pyramidal decussation is the key important comparison. Now let me take to still a higher up level. I can call them as middle portion of the medulla oblongata. Again, do compare the same thing when you study the external features of the medulla oblongata. We had anterior median fissure, then we had pyramid. So that's why you could able to see pyramid. On either side of pyramid, you had olives. I can call them the inferior olivary nucleus. Then on either side, we will be having inferior cerebellar peduncle that you have studied in external features. Same likewise. Let me show you the commonest points first of all. As same, you could able to identify the reticular formation. As same, lateral spinothalamic tract. As same, anterior and posterior spinocerebellar tract. As same, the spinal nucleus and the tract of trigeminal. Then as same, the nucleus cuneatus and nucleus gracilis. But here we had a detached portion of accessory cuneate nucleus. You're supposed to remember posterior white column tracts. And as same at the center, you will be having the central canal. And here, what am I supposed to mainly concentrate over here? Mainly the sensory fibers, which takes over from the nucleus gracilis and cuneatus of both the sides. The sensory fibers are now descending downwards, and now they cross on towards to the opposite side, like same as pyramidal decussation. So now here I'm going to call them as sensory decussation. The posterior column tracts from the nucleus gracilis and cuneatus will cross over at the level of medial lemniscus in the middle. And at this level, when you study any important concepts, we had studied external features between pyramid and olive. Hypoglossal nerve rootlets are emerging between olive and inferior cerebellar peduncle above onwards 9, 10, 11. Cranial nerves are emerging down. That we studied in the external features. Same those nuclei very clearly you can see hypoglossal nucleus means to all the cranial between pyramid and olive behind. Point of emergence you see on the external features, and you could able to identify even the dorsal nucleus of Hagus added by nucleus tractus solitarius. So these are some few differences you are supposed to differentiate from the lower medulla to the middle medulla. That is, the key difference is pyramidal decussation took place and here sensory decussation. So let me take you to still more higher up level, exactly pontomedullary junction, so that I could able to take them as upper part of the medulla oblongata. Again, anterior median fissure you could able to see. You could able to see the pyramids. Then you could able to see the inferior olivary nucleus. And on either side, you could able to identify the inferior cerebellar peduncle. Again, the same commonest things you could able to identify from the previous slide where you could able to look it on here. Here I'm going to have is the group of medial lemniscus. Is the same you could able to identify the medial lemniscus, medial longitudinal fasciculus and the traps. Followed by reticular formation is same. Then the same lateral cortico spinothalamic tract is same. Then I have anterior and posterior spinocerebellar tract is same. Then the nucleus and the tract of trigeminal nerve is same. Then you're going to have is the nucleus tractus solitarius is the same. Some commonest features I have showed you and what are the main important things you're supposed to look over from the previous conversation. At this level, I am supposed to identify mainly the hypoglossal nerve nucleus is behind and then the nerve is emerging out at the junction between pyramid and the olive. The 12th cranial now has emerged outside is the same external feature and the internal feature. Then between olive and ICP, you could able to identify the emergence of the vagus nerve, that is the 10th cranial nerve, with a combined nerve nucleus called as dorsal nucleus of vagus, the nucleus ambiguous, and nucleus tractus solitarius as the functional components. On a group, these three nuclei take part in the formation of vagal nerve nuclei and the vagus nerve will emerges outside. And these are the main important concepts to be studied for the upper part of the medulla oblongata. Next, still I will take you to the higher up level from medulla cut sections. So external features we studied as basilar groove, anterolateral aspect of the Pons, trigeminal of emergence, formation of middle cerebellar peduncle. Same in the anterior aspect. Same you study as anterior basal portion and the posterior portion I'm going to call them as tegmentum. Here we will be studying the level from the upper medulla. Now I'm ascending into the next level, that is from the inferior olivary nucleus level. Now I'm ascending into the Pons level. So now here we could able to study about the lower part of the Pons. So when you study Pons, an important concepts to understand. Transverse section at the level of lower part of Pons, I can use the term called as facial colliculus. When you study the external features of the Pons on the posterior aspect, median sulcus on either side, medial eminence, lower end of the medial eminence will be elevated to form facial colliculus. The definition of facial colliculus is like, I have an abducent nerve nucleus and I have a facial nerve nucleus. Facial nerve is formed and it winds around the abducent nerve nucleus and the nerve is emerging outside. Pontomedullary junction, medial to lateral, 6, 7, 8 cranial nerve. So now this is my basilar groove, this is my pontomedullary junction where my 6th cranial nerve is emerging outside. And I sweep around the nucleus of the 6th and the 7th one exits outside as the seventh cranial nerve. And you go still laterally, I will be having my eighth cranial nerve. So where the prominences of the vestibular nuclei and the cochlear nuclei would be able to identify. This is all about the now nucleus we discuss. From the anterior aspect basilar groove, we could able to identify numerous. You could able to identify the pontine nuclei in the pons. You could able to identify a transversely running fibers which bridges to the sides, crossover from right to left side as middle cerebellar peduncle. And also I could have my longitudinal bundle of corticonuclear and corticospinal fibers. This is the first step which I'm supposed to remember in the basilar part. And in the moving towards tegmental part, I'm going to have is the important one that is called as trapezoid body. Trapezoid body is more prominent in lower part of the pons and is less prominent in the upper part of the pons level. Then the same tract, when you compare from the lower medullas, cut sections, is the same thing. Again, we get the same structures. Medial lemniscus, we get of is the spinal lemniscus, we get is MTR, medial longitudinal bundle, tectospinal and reticulospinal is the same. Then we had is the same nucleus and tract of trigeminal nerve. And with an ICP is a common word. So all structures are same when you compare from the lower level. The difference of adding up the basilar portion and mainly the as we are talking at the level of facial colliculus, I'm supposed to mention my abducent nerve nucleus, facial nerve nucleus winds around and exits outside. So this is the key important concepts I need to understand regarding the lower part of the pons. The same diagram represents the upper part of the pons. So you just compare now. So now you could able to identify transverse section at the level of the upper part of the pons. So now here I'm going to use the word called as trigeminal nerve nucleus. At the anterolateral aspect of the pons, trigeminal nerve is emerging outside. Do compare back again basilar groove, basilar part. I have my dotted structures. I could able to call them as pontine nuclei. I could able to call them as longitudinal bundles for corticospinal tracts. Then the transverse fibers are running on, takes part in the formation of MCP, that is middle cerebellar peduncle. And as I already mentioned, trapezoid body is less prominent. Is the same structures, is the same structures what you identify behind the lemniscus. Is the same structures you identify here. I'm going to call them as medial lemniscus, trigeminal, spinal, and lateral lemniscus. Is the same MTR, medial longitudinal bundle, tectospinal, and rubrospinal. The key additional point is very important. The posterior aspect of the pons is studied the cavity of the fourth ventricle, which has been covered by superior medullary velum. I could able to identify the cavity of the fourth ventricle. On either side, you could able to identify MCP. Sir, what should I need to remember the main point? Anterolateral aspect of the pons. Trigeminal nerve is emerging also. So we could able to see the emergence of trigeminal nerve, which will be having a nuclei, motor nuclei of trigeminal nerve, sensory nucleus of trigeminal nerve, and a mesencephalic group of nucleus of trigeminal. These three nuclei takes part in the formation of a bundle of fibers for the trigeminal nerve and the emerges from the anterolateral aspects. Next step, once we finish off the forms, now we will ascend into the midbrain. When we study about the subsections at the level of midbrain level, Posterior aspect of the midbrain, we use the term when we study external features called as corpora quadriza minor. Superior colliculus, right and left, and inferior colliculus, right and left. So exactly we are trying to do the cut sections at the level of inferior colliculus, go higher up at the level of superior colliculus level. So now we'll try to see the cut section at the level inferior colliculus. So when you study the external features, you try to look in, we had is the on the anterolateral aspect of the midbrain, that is the interpedunclar dorsal lateral, you had crus cerebri. So indirectly, so now this is our crus cerebri. This is our interpeduncular fossa. It is purely a highway motor pathway for the cerebral cortex to spinal cord. All the motor descending tracks are descending through medial portion with frontopontine, lateral one third for the temporoparietal and occipitopontine fibers. And the middle portion will be taken over for the corticospinal and the corticonucleus, the descending tract, pyramidal tract fibers. And same comparison from the Pons, you come back again, you had is your MTR, medial longitudinal bundle, tectospinal, rubrospinal. And all in the tegmental part, you identify all the lemnisci, medial, trigeminal, lateral, spinal and lateral lemnisci, everything is same. Our main title should give off is cut section at the level of nucleus at the level of inferior colliculus. Exactly when you study external features, inferior to the inferior colliculus in the midline in the external features, we studied that the trochlear nerve is getting emerged outside. Now try to see this is a cerebral aqueduct of midbrain and try to identify the nucleus of trochlear now. Very important word is like trochlear now is also decussating towards to the opposite side. So means the trochlear now supplies to SO4, that's called superior oblique muscle. So means my right side nucleus controlling my left side muscle and vice versa muscle. So my right side nuclei controls my left side SO4 superior oblique muscle to be remembered. So that's why the crossover takes place over here, and followed by you had as usual, as I said, reticular formation is common. This is the key difference you're supposed to remember for the level of inferior colliculus level. Now you ascend up into still more higher up level into the superior colliculus level. Is the same interpeduncular fossa, the crus cerebri, frontopontine, corticospinal, parieto, fronto, occipitopontine fibers, that is the motor fibers are descending downwards. We had is the tegmental fibers, decussation is taking place. We had is our same reticular formation. We had is our medial, trigeminal, spinal, lemnisci is common. Only thing which is missing, the lateral lemnisci is missing on. Cerebral aqueduct of midbrain is common. Main portion to be remembered is cut section at the level of superior colliculus. Here I had a very important nucleus when we studied anterior aspect of the midbrain medial to the crus cerebri, emergence of the third cranial nerve is emerging also. So now this is the nucleus for the oculomotor nerve, and the emergence will take place on the anterior aspect through the substance of the red nucleus. Sir, what is the key important combinations we're supposed to remember between the crus and the tegmentum? In between, we had a darkened gray matter we could able to identify in both the cut sections. We are going to use the word called as substantia nigra. This is all about the cut sections of the midbrain. To manner. We started from the spinal cord. We ascended into the medulla oblongata, then into the Pons, then into the midbrain. During this study, spinal cord cut section we have explained by ascending and descending tracks. In the medulla oblongata, we had three important levels we have studied. One at the level of pyramidal decussation, sensory decussation, and at the level of olive. And for the Pons, we have studied at the level of facial colliculus, trigeminal nerve, nucleus. And for the midbrain, we studied about inferior colliculus and superior colliculus. So always do study in a comparative manner. Number one, cut section at the level of spinal cord. Number two, cut section at level of pyramidal decussation. Number three, cut section at the level of sensory decussation. Number four, cut section at the level of olive. Number five, cut section at the level of facial colliculus. Number six, cut section at the level of trigeminal nerve nucleus. Number seven, cut section at the level of inferior colliculus. And number eight, cut section at the level of superior colliculus level. If you study like this, you'll understand all the internal features for the brainstem in a simpler and an easier format. And do go through the channel and listen first to the external features. Once you understood the external features, understanding internal features will be more easier. So stay tuned to next anatomy. See you in the next session.